Mr. Bryan, good morning. Dr. Vangsness. It's the 23rd of January 2013. We're at the USC Keck School of Medicine Outpatient Surgery Center looking inside your your left shoulder from behind. Here is the socket. Here is the ball. You can see as I rotate the ball back and forth. You can see that. First, look at some landmarks that you can appreciate. Here's the biceps tendon. Comes up through this little hole right up in here. Pull that little spinal needle back for a second here. Through the hole as we look right up through there, and that's where the biceps goes underneath. This is your rotator cuff from behind. You can see my probe. Probe's got about 3 millimeters of length, so it looks bigger than it is, but this is all the rotator cuff. Right across, we come right through here. The cuff looks great. Underneath the cuff, this needle is for when we come above the cuff. I'll show you that later. But the rotator cuff looks good. The head of the humerus looks good. All the way back, we call that the bare spot. Looks very good. Normal, normal, normal. Now I'm switching up. Look way in the back of your shoulder. Everything looks good. Nice and see that normal red blood vessels of this is the back posterior part of your shoulder capsule. We're looking in the back. Everything looks very healthy. The cartilage, okay, there's not real smooth there. It's a little rough in that spot. Really smooth here on the ball. Generally the ball's pretty smooth. A little bit of wear and tear in the back there, maybe age relevant. Nothing too terrible. Now I'm looking at your socket. Here's my probe in the socket. As we come across here, a little rough, not smooth as a baby's bottom. Little early changes of our early arthritis. Right in through here. Lift the arm up for me, Chief, behind me. Here's where we worry about dislocations and such, and that looks very good. The ligaments look very good. Right here. Now we're talking about posterior labrum, and here's what I want you to appreciate. The posterior meaning the back. I'm looking from the back. The biceps comes here to the 12 o'clock position, and this is the little bit of fretting and fraying and tearing that they saw here. We'll smooth that down. Not really bad, not terrible, not horrible. That's good. We'll just smooth that down. Give me the RF device, please. So far, everything looks pretty darn good. Again, you're not 22 anymore. And so, got the foot pedal to me. RF, thank you. Good. I just like to smooth this down a little bit. Here's the normal recess right in the front here. Just kind of smooth this down with the RF. See, I've got a little bit of a little cannula coming in through in the front. Everything looks very good. So we got that nicely smoothed down. It'll be nice and stable for you. Now I'm going to look from the front to the back. We'll go to pause. In the next view, you'll see from front to back. And then as we come up in here, the needle right there, I'm going to come above the cuff or below, looking above. And we'll look down on the cuff shortly. We'll go to pause.